This is Dr. Lindsay Wilkinson from Portland Psychedelic Medicine. I am doing a quick video blog post this morning talking about this genetic test called Genomind. There's also another one on the market that's really common called GeneSight. And I found that both of these tests are really, really helpful for my patients with chronic anxiety and depression who have really struggled with medications, either with bad side effects or they just haven't been effective for them, and patients have tried multiple medications. And often patients are coming to me to treat with ketamine because they've had a struggle with other medical interventions in order to help improve their symptoms of depression and anxiety. So this test called the Genomind is really, really helpful for some patients. Not for everyone, but I do recommend it often. And what I've been really surprised about is that many patients have never even heard of this. They've been to psychiatrists, primary care physicians, psychiatric nurse practitioners, many providers over the years. And I just don't think very many people know that these tests are available. So this is just a helpful kind of overview. This is a sample report, so this is not a real patient. You can see right here it says Bob's sample. So this is right from the company Genomind. And it's a pretty complicated test, so providers do need some additional clinical training, and the company Genomind will provide lots of extra clinical support for doctors and psychiatrists and whoever else is taking a look at these test results for patients. But essentially, let's just take a quick look. So what this is doing is showing whether a patient has changes or alterations from what we call the quote-unquote normal for different genes that can impact how a medication is metabolized in the body, how well it's taken up, how well it's detoxified. And so this test is quite comprehensive. So all of these are the genes over here on the left. So MTHFR is a really common one we work through for naturopathic practice. This is an enzyme that activates certain vitamins in the body, and alterations in this gene can have a really significant impact here. This one on cardiovascular health, and this one specifically on mood and anxiety. So this is just an example. You can go all the way down the list. This is pages and pages that look at different genes. So if it's green, that means you have a quote-unquote normal response. And we know, of course, as humans, there's a huge range and variation in our body's anatomy, in our body's genetics. And so this is basically normal in terms of what scientists know about how a medication will work based on these enzymes and these different genes. So green would be considered normal, red would be considered a higher level of risk. So if there's an alteration, if it's red, that means there's at least some level of alteration in that gene. And then it will explain over here what that might mean. And it'll give you sort of a little bit of a visual code right here on the right side. So there's several pages, and there's no reason for us within the context of this video to get into all of those details, but it's important for us as providers to really know how the body is most likely to respond or not respond to certain medications. So these ones are different, very important liver enzymes. The liver detoxifies almost everything in the body, from your own endogenous hormones that you produce, to medications, to supplements, to anything like xenobiotics, things that you take in from your food. So it's really important to know how well these enzymes are working, not only specifically for trying to treat anxiety and depression, but how well are your foundations of health working? How well is your body able to get rid of toxins, which does impact mood, blood sugar, hormones, all of that, which can play into anxiety and depression as well. So then you go down here, and what I love about this test too is that it breaks down all these very specific medications, antidepressants here. So you have all of these antidepressants, and based on this particular gene alteration in this sample patient, it's gonna show, oh, there is a higher response or higher odds of remission for a patient's anxiety, or in this case depression, because these are antidepressant medications, because of this gene alteration. So not all gene alterations are necessarily bad. Some of them have been shown scientifically in studies to produce a higher level than an average response of remission in depression or anxiety, which is great. So these are the SSRIs, the SNRIs, other classes of medications that are commonly used to treat depression. And then if you go down, there's even more here: tricyclic antidepressants, MAOIs, and then mood stabilizers. A lot of patients are taking different mood stabilizers like lamotrigine. I see lots of patients on this, which has really helped them. Gabapentin sometimes for pain, chronic pain, and others as well. And then it will also look at the antipsychotic medications. for some patients that need that level of treatment. And anxiolytics is important too. So some patients are going to have a different response based on their genetic profile to things like Xanax or buspirone as well, which are really common in clinical practice as well. There's also a list of ADHD medications. So often anxiety and depression have lots of significant overlap with other mental health diagnoses, such as ADD, ADHD, post-traumatic stress disorder. So many are overlapping. And then also it looks a little bit at methylfolate. So this is because of that MTHFR mutation we talked about up front, but it has this supplement here, lots of sleep medications. It goes over that as well, and chronic and pain medications as well. Something as simple as Tylenol or acetaminophen, all the way down to naproxen, to codeine and fentanyl. So this will tell you if you're more likely to have an adverse reaction to morphine or codeine, or less likely of a reaction, and you might be a person that needs more of that medication to experience pain relief from it. So it's just a very helpful test. It has some miscellaneous ones here, and I don't know where this is on the test, but ketamine, S-ketamine is also on here. So that's really nice too. When we're thinking about treating with ketamine, it's great to have this genetic profile so I know exactly how other medications that a patient might be taking are going to impact that ketamine treatment, as well as ketamine as a medication itself is on this list. So this is just a really basic overview. Typically this, if a patient has been on multiple medications over the years to treat anxiety and depression and has not been responsive for whatever reason, maybe they had to stop because of a side effect or it just wasn't really effective at all, there is usually partial coverage if you have private insurance for that and some out-of-pocket cost. I think that through this company there is a maximum out-of-pocket cost. So if for some reason it's not covered at all by your insurance, I think $399 is the maximum price out-of-pocket. But don't quote me on that because I think it does change all the time. But what I do as a provider is you come in to see me, we do a medical intake, and I might recommend this test. The nice thing about a genetic test is that it's only ever done once because your genes don't change. So you can get this test done one time and take it to any mental health provider or even primary care physician or other allied healthcare professional that you see for the rest of your life. And this will give them some information about what your genetic profile is like and what might be the least or the most effective treatment options for you. So in terms of, it's not like a blood test you have to get done every year, every 2 years. This is going to stay the same. So in terms of investment, I do think it's a great long-term investment if you're someone that's been struggling with anxiety and depression for years and years and haven't had this information available to you. So yeah, what I do as a provider is I put the requisition in online, and then I send you the little requisition code. You go on and arrange for shipping and payment. They send you a little kit in the mail, and it's just a buccal or a cheek swab. So it's kind of like a long Q-tip, and you brush the inside of your cheek. You just follow the directions. It's very, very simple to collect, and you ship it straight back to the company, and then I get the test results within 1 to 2 weeks. And if you have any questions about payment, you can just reach out to the company directly and say, hey, this is my insurance. What would it be like, out of pocket? And they can give you a much clearer idea of what that cost might be. So I hope this is useful to you, and please feel free to ask any of the doctors at Portland Psychedelic Medicine. The naturopathic providers can order this test for you if we think that it's going to be clinically helpful and relevant. This is something that you want to do. Please ask us about it because I found it to be very useful clinical information. All right, have a wonderful day. Thanks so much.